That's why it's called a game changer.
What do you think is so interesting about semaglutide? It's been called a game changer. You agree with this? And if so, why?
So why is there even a field of anti-obesity medications? What do anti-obesity medications really do? And this goes back to something I was mentioning earlier. Remember I said that fat loss is defended against? Right, here's the idea. And it's not intuitive to everyone, and maybe not everyone knows this, but our brains are expert at recognizing fat loss. Fat cells make this hormone called leptin, and whatever the highest level we reach in our weight, our brains bookmark that as the right weight that we should stay at. And that level of leptin, that much fat, is what we should stay at. And so the brain recognizes a drop in leptin. And when weight loss is recognized and fat loss is recognized by our brain will defend against that. And so what the brain will do is it will combat weight loss by really only two things: increase our appetite and to decrease our metabolic rate. And the most common or the most substantial is that there'll be an increase in appetite to weight loss. So what do anti-obesity medications do? What does semaglutide do? It really can be thought of as the medication defends us against the natural defense that the brain will go through by increasing appetite to try to defend us against weight loss. Anyone listening who's tried to lose weight will recognize that as you lost weight, things became more and more difficult. Weight loss slowed and pulled in somewhere. And if anything, hunger or wanting or desire or drive to calories was stronger. That wasn't your fault. Regaining weight isn't something for shame or blame. It's actually biology. And so the role of medications is defend against that. And what's so important about semaglutide is just the degree of its effectiveness. So we have not seen medications that can be supported with behavioral therapy where someone will be losing 18, 19, 20, 21, 22% of their body weight and keeping it off. Picture a 250-pound guy, right, who's, his blood sugars are mildly elevated and he has high blood pressure and maybe high cholesterol, just as an example. And so a 20% body weight loss means that this guy gets to hang out at 200 for the next 30 years of his life instead of the progressive 250, which can even become more because obesity is a progressive disease. So that we've never seen. We've never seen numbers like that. That's why it's called a game changer. We've never seen that kind of efficacy. It's extremely common that patients will lose in the MedCan clinic, weight management program, 20% of their total body weight and be in a remarkable position to keep that off. And so that's the game change, is not that medications are effective and safe, but the degree to the effectiveness of this medication.